quite a few speakers in this little segment with not much time, which is a bit of a shame. But Getty Israel is our next speaker. She's a regional director at the Clinton Foundation in Jackson, Mississippi. Her work in public health addresses disease prevention through behavioral lifestyle change intervention programs. She's an advocate for preventive-based public health policies and has led initiatives regarding child health, public safety in Mississippi. Getty? I'm sorry, I'm going to have to really hold you to not very long.
Carla, thanks for having me, first of all. I want to make this very quick. Most of our problems are the same. We're in Mississippi, it's rural, poor, it's primarily black, and I'm in a very fortunate position now. Now let me first say this, disclaimer. I did not come here to represent the Clinton Foundation, all right? But because I am currently in that position and using that position to make some significant changes, I'm going to talk about what we're planning to do. You probably know that every year we persist in having the lowest, or very close to the lowest, Louisiana, Mississippi, back and forth, all right? So, as regional director, Humana is also our national partner. And Humana is a very strong partner and really wants to see some improvement in Mississippi. We're actually in Adams County. Unfortunately, the foundation is not throughout the state. But it gives us the opportunity to be very aggressive and ambitious. So, I have already convinced Humana to create a dialogue with its network providers. I said if you could just get them to start talking to their member patients about breastfeeding. Ask the question that ACOG wants them to ask. Are you breastfeeding? Do you plan to breastfeed? Humana said yes. As of today, I spoke to United Healthcare's vice president, and I'm asking that they do the same thing. I've also approached Blue Cross Blue Shield. It dominates the market in Mississippi. Would you please follow Humana's leadership and simply encourage your network providers to ask its members or patients, are you planning to breastfeed? Because often ACOG members are not doing this. It's a very simple policy change. Now in 2006, we passed a very comprehensive bill. Nothing else has changed in Mississippi. Our rates remain low. In Adams County, with the help of Miranda, who will be coming up next, and other people like her, we will be implementing a very comprehensive, integrative maternal and child health program. We will be recruiting women in their first trimester, and we will be training laypersons to become doulas, lactation counselors, and they will also work on our early childhood education program. We will be encouraging and supporting these moms to have a healthy pregnancy by helping them to maintain a healthy body weight throughout their pregnancy, following IOM guidelines, Institute of Medicine's body weight guidelines. Because what we know is maternal obesity leads to maternal hypertension, gestational diabetes, high C-section rates, and as someone established earlier, women who are overweight and obese tend not to breastfeed. And so we will engage them once a week in a structured setting in a doctor's office. We have 3 doctors working with us. They're all OB-GYNs. There are only 4 in Adams County, only 1 hospital in Adams County, no lactation consultants, 1 lactation specialist who works for WIC, and she's responsible for 4 counties, 1 peer counselor. So my goal is to take those laypersons and turn them into MCH professionals. Humana will be paying for this, all right? For at least 3 years, I will have funding for this project, which is major for us. And so we will teach them about eating healthy, exercising. We will actually be walking with them, prenatal yoga, how to prepare healthy baby food, family planning, staging pregnancies. We have a natural family planning person who will be teaching that and following them for 7 months. It's extremely integrative, and during the first 6 months of life, we will actually send them to the hospital to make sure that the doctors and hospitals adhere to their birthing plan, skin-to-skin contact, breastfeeding for at least 6 months of life, and we will support all of that. We will begin educating them on breastfeeding from the very beginning. in the very first trimester. We want them to create a birthing plan, a parenting plan. And as of today, we've decided to put that online. Before, we were thinking about doing a workbook, but after listening to some of these ideas today, we decided to put that online. And so for the first 6 months of life, we will be encouraging them going to their home. We will make sure the daycares are in compliance, because Mississippi is one of only maybe 5 states that require its daycare facilities to support breastfeeding babies, all right? And we will make sure the workplace is in compliance based on state law and federal law. Many employers, many daycare facilities don't know the law. Many moms don't know the law. So there's a lot of education that needs to take place. Last thing I want to say is today I spoke to Miranda and Stephanie about what I believe is a strong need for the IBCLC to be licensed. And I said to them, if they're willing, because I'm not an IBCLC, I'm a public health practitioner. I do policy and programs. But I said, if you're willing to go there, I'll lead that effort and make Mississippi the first, perhaps the first state to issue a license for IBCLCs, so that the insurance company is forced to recognize them, because I have dealt with them and I know that they want a state-issued license, a professional who has a state-issued license. They really don't care about your experience. They don't care if you're, they really don't care, as long as you have a state-issued license. So I'm working in the workplace to get the employer to create a lactation room, to get the insurance company to do its role. All of these guys are players. They are major players. What I would like to see on a national level is for each one of us in our respective communities or states engaging all of the players. We can't just do the intervention. We can't just do the education, because if policy never changes, we have to change the policies within insurance companies, the hospital setting, and the employers. We have to change policy, and that's my vision and my plan for Adams County, Mississippi, and we hope that it will have an impact around the state, and perhaps the next time we come here, our rates will be higher, our infant mortality will be lower, because our maternal obesity rates will also be lower. So that's it. Was that short enough?